Welcome to the bright side at B'nai Abraham Chabad. Our starting prayer for today is Psalm 124. Shir HaMalos LeDavid, Lulei Adonai Shahayalanu Yoymar Yisrael, Lulei Adonai Shahayalanu Bekum Aleinu Adam, Azai Chayim B'launu B'charois Apam Banu, Azai Hamayim Shtafunu Nach La'avar Al Nafshenu, Azai Avar Al Nafshenu Hamayim Hazeidoinim, Baruch Adonai Shalai Nasananu Teref L'Shinehem Nafshenu Ketzipar Nimlotam Pachyoik Shem Pach Nishbar Vanachnu Lotnu Ezreinu B'Shem Adonai Oisei Shamayim Ba'aretz. The Song of Ascents by David. Were it not for the Lord who was with us, let Israel declare, were it not for the Lord who was with us when men rose up against us, then they would have swallowed us alive in their burning rage against us. Then the waters would have inundated us, the torrent would have swept over our soul, then the raging waters would have surged over our soul. Blessed is the Lord who did not permit us to be prey for their teeth. Our soul is like a bird which has escaped from the fowler's snare. The snare broke and we escaped. Our help is in the name of the Lord, the maker of heaven and earth. Join me in the Mitzvah of Sadaqa. One of the greatest sages, Rabbi Yochonon ben Zakkai, was on a search. He sent his students out into the world, and the question was, what is it that you need? What is it that a person requires in order to live a righteous and fulfilling life? His student, Rabbi Eliezer ben Harkanos, came back. He says, I have searched and searched, and the quality, the number one quality that I have found as the best advice is to develop an ayin tov, a good eye. To develop a good eye, to cultivate a certain lens on how we view others. When your lens on life is good, then most likely you'll see the good. You'll perceive the good. What we see is often dependent on what we look for. The story today is about a Jew from a neighboring Hasidic community that once came to visit the Rebbe, and he requested a blessing, but he also had a question that he posed to the Rebbe based on a Talmudic passage that was bothering him. He quoted the Talmud at the end of Chagiga, which says the following statement: even the sinners of Israel are filled with good deeds as a pomegranate is filled with seeds. And this Jew asks the following question: isn't this statement a contradiction? If someone is truly a sinner of Israel, how can the Talmud say that this person is filled with good deeds as a pomegranate is filled with seeds? Doesn't make sense. The Rebbe closed his eyes and began to cry. After a few moments, the Rebbe turned to this Jew and he said, I want you to know that I have a question on the very same passage that you just quoted. If the Jew that we speak of is truly filled with good deeds, how can the Talmud call him a sinner of Israel? What we see here is a classic example of two individuals looking at the identical text and seeing something vastly different. It's not just the spiritual state of the Jews that the Talmud is discussing. What becomes clear is the mindset of the person studying the Talmud. And the people that are having this discussion in the Talmud, how do they view each other? What do they choose to focus their attention on? Is it the positive or the negative? So the question is, we all judge. We try to judge people favorably to the side of merit. But what is my bias? What am I looking to emphasize when I look at another person? Am I looking for their positive qualities, their positive character traits, or the opposite? I want to share with you an image, and I'll ask you to take a few moments to look at this image and tell me what you see. Here's the image. This image is actually an optical illusion, and it's called My Wife and Mother-in-Law. You can either see a young woman or you can see an older woman, depending on how you view it. And researchers found that the social standing of the viewer, the person who's looking at this image, predicted which image they saw first. Was it the young figure or the old? In other words, what they ended up seeing was simply a projection of what they were looking for. A fascinating experiment. I also came across another image of two doctors that were sitting on a bench, and the caption said, "We are eye doctors." And something about the eye that many people don't realize is that the eye doesn't see. It's the brain that sees. The eye simply transmits. And so what we see is what's coming through the brain and into the eye. What we see is affected by our past, by our memories, by our feelings, things that we've seen before. And what is our default lens? Is that default lens positive or negative? So the challenge to develop, to cultivate a good eye, the capacity to be able to see the goodness, the kindness in others, is the essence of what it means to have a positivity bias. When we see the world in such a way, we'll be able to interpret events, people, experiences in a favorable light. We'll be able to see the good, we'll be able to see the positive. No matter who it is, every single human being has redemptive qualities and the capacity for redemptive vision. It's not easy. It requires effort. But what better time than now to work on developing and cultivating a good eye, how we see others, how we view the world, and looking through the lens of a positivity bias. Our guest today is Dr. Ryan Morgan. Dr. Morgan is a pediatric critical care physician in the Department of Anesthesiology and Critical Care Medicine at Children's Hospital of Philadelphia. Welcome, Ryan.
Thank you.
I understand that you are you're working in the ICU at CHOP, helping little children get better. And tell us a little bit about your work as a doctor.
All right, so as you mentioned, I'm a pediatric intensivist, which means here at the Children's Hospital of Philadelphia, which means that I exclusively care for critically ill children in our pediatric intensive care unit. And so that ranges from anything from children recovering from complex surgeries to children who come in with infectious diseases or traumas or a variety of other ailments. And
this must be a very, very difficult and intense experience. I can't imagine dealing with children who are so sick every single day, but somebody's got to do this job, and we are so grateful to all of our healthcare heroes, but especially people like you on the front lines, just there to help people and bring healing to the community and to the future members of our community. So tell us a little bit about, before we get into the current situation that we're dealing with, I'm wondering if you can share with us a little bit from your experience about the power of positive thinking and how a patient's mindset, or perhaps the attitude of the family, in this case, might actually impact the physical healing of the patient. Have you seen any correlation between the two in your career?
Absolutely. I think a lot of it is probably a little bit more anecdotal than the science I usually hang my hat on. But there actually has been some science in this in the last decade or so, and fighting an illness, whether it's acute like I see or chronic, is an active process. It's not just me administering medications. So I think there's a lot to be said for being in the right frame of mind and having the right energy to tackle an illness. And in pediatrics in particular, the link between a child's health and a family's well-being, whether it's physical, emotional, or mental, is huge. When we care for children in the hospital, it's not just us and them. We really try to form a partnership with the child, the parents or other family members, and our team to try to figure out kind of a lot of it is the medications themselves and the therapies that we're providing, but a lot of it is a little bit more holistic, and we have to think about the child in the context of who they are and who their family is. Children are resilient, but they also are much more in tune with the attitudes of their caregivers than we sometimes give them credit for. So when we see sick kids get better and then begin to thrive, it's dependent on a lot more than just what doctors and nurses are doing. It's really kind of dependent on their overall environment. So I think, especially in times like this, the power of a positive attitude and the impact that it has on the people around you as well as on yourself is really pretty critical.
Now, I understand that in most hospitals today, because of COVID-19, patients are not allowed to have visitors. I'm wondering if Children's Hospital has the same policy, or because the children are young, the parents are allowed to be in there.
So we're a little bit more strict than we usually are, but we still do have parents at the bedside. So we try to keep it limited. Usually we have you're able to keep a list of both your biological parents and then usually about 4 other guests who can be in and out. And we're really trying to limit it now to the parents and for children in our isolation unit, either because of confirmed or suspected COVID-19. That's usually limited down towards 1 to really try to keep both the community safe as well as our healthcare workers and our patients themselves.
So you mentioned that you were just coming from the isolation unit. What's the isolation unit like?
So I think we've been, in general, I'll say we've been, really lucky in terms of in pediatrics, and that children get this disease a lot less. When they do get it, it tends to be more mild. That being said, there are children throughout the world and throughout this country who have been affected by the disease, and some have become quite ill. And so it's required that really all hospitals, regardless of how many patients you're anticipating seeing, have had to come up with their contingency plans for how to care for those patients while keeping everyone safe. So within our ICU at CHOP, we do have a small subsection where a lot of folks work that patients who either have testing pending or who do have confirmed coronavirus disease are there. And we're pretty lucky here that we've had really adequate personal protective equipment throughout this entire pandemic. So really having it all focused there kind of allows people to approach the care of these patients in the safest way possible for everybody.
Thank God. That's good. So you've been personally treating some of these children who have been tested positive for COVID-19?
Yeah.
Maybe you could share with us something that you've learned from this intense experience.
So I think if you take everything on face value, and certainly if you pay much attention to the media, there's a lot of, it's all doom and destruction. And I think you don't have to look very far to hear that side of the story. And this is something that, we as a society have not faced something of this scale and scope in a very long time. But I think, there are certainly a lot of bright sides to this. When we're focused really in the moment of the last couple of weeks, there's a lot of discussion and a lot of debate and a lot of politics surrounding the ideas of when do we open, how do we open, exactly what our next step should be, and nobody quite agrees on that. But I think what I've really learned, if you look at this over the course of not just a couple of weeks, but the whole last, I've been very surprised by how substantially and how well our society has adapted to this crisis. It was really kind of, if you think back to February and we were to imagine a time when we would all isolate like this, when we would all do our small part to try to stay home and to lessen the spread of this disease to the extent to which we have. There's a lot of downsides to it, but I think it's actually quite remarkable that society has been able to do this. And you can look in the newspapers and see the pictures of Jacksonville Beach, but I think most places and most people have actually done their part. And it's for most folks that are staying home, it's not for them. They're doing it for the vulnerable in their communities. They're doing it for healthcare workers like me, so we can more safely go to work. And I think it's pretty inspiring.
Wow. That is a remarkable bright side to this whole experience. How people have taken it so seriously, and as you so eloquently mentioned, not just for their own safety and health and protection, but thinking about the needs of others and how to protect each other as a society, how we can each support each other and do what's safe and healthy for everyone. So that's definitely something that we can take away from this as a society.
It's early, and I don't think we really know what all the numbers are going to look like in terms of the number of cases of this disease, the number of deaths. But regionally, if you look, I think we're going to see that what people did as a community, not just those of us in the hospitals, but what we did as a community really has substantially flattened that curve. And it is really likely that ordinary people who had no interest in, tackling this disease actually did an extraordinary amount to curtail it. That's pretty incredible.
Well, we have so many teachings in Judaism about the fact that each of us are interconnected with each other. We talk about the unity of, as an individual, there's the body and soul elements that are connected. Just as the body needs its nourishment and nutrients, the soul also requires that on a spiritual side, because there's a holistic attitude to the way we view an individual, not just physical. But then we talk about the importance of being connected with each other and interdependent as a society. And the point that you're making really highlights this idea of how the community has come together. And while we have people like yourself who are literally on the front lines of the battlefield, there's a whole support team behind you in all kinds of industries and fields, ordinary people that are doing their part to respond in the appropriate way, in a beautiful way. So Tell me any interesting stories that came out of your work at Children's Hospital lately that you could share with us. Any positive bright side stories that come to mind?
I can't share patient specific stories, but I think I'll say, I think there's been a lot of recognition of the frontline workers, which is kind of a new term, which it's nice to see this gratitude, and I think we're all feeling those effects. But I think it's really, I'm blown away on a regular basis with the people that we're surrounded with here, and like I said, I think those of us who care for children are really lucky that we're not seeing this nearly on the scope that our colleagues who care for adults with this disease are dealing with. And I did some of my medical training in New York, and I hear harrowing stories, really, even now, from medical systems there. But I think, I mentioned that I'm fortunate to work in a place that had adequate personal protective equipment from the onset of this. That really hasn't been the case everywhere. And despite that, folks have really been consciously putting themselves at risk to provide life-saving care, or to provide comfort, or to provide support services. There's a Nelson Mandela quote that I'm going to butcher, but it's along the lines of courage isn't the absence of fear, but proceeding forward despite that fear. And I think, when you look at the people in the ambulances and the nurses and respiratory therapists who are at the bedside of these patients for hours and hours at a time, and the people who come in and clean the floors, they all know what they're doing. They all know that there's risk there. And despite that, they're able to file it away somewhere and proceed with the job that they know that they have to do. And it's really, a lot of times we just kind of put our heads down and do it, but every once in a while in these moments, I take a step back and look at the people I'm surrounded with, and I'm really just in awe of them. And so, it's a trying time, but it doesn't take a whole lot to look around and find inspiration around us.
Wow. Well, thank you for sharing that perspective. We don't take anything for granted anymore. We recognize how everyone is doing their job, and each one of us are integral to the community, to the society at large. And together, we'll fight this, we'll persevere, and God willing, we'll be able to come out stronger and with a new appreciation for the blessings that each of us have in our lives.
I believe we will.
Okay, well, thank you so much for taking time out of your busy schedule to join us today. Much appreciated, and thank you for all the work that you're doing to help us come out of our homes safely.
Thank you.
All the best, Ryan. Thank you for joining us. And I'd like to take a moment to thank our sponsors. Thank you to Diane Tucker for dedicating this series to the memory of Dick Tucker. If you enjoy this program, please consider even a small contribution to B'nai Abraham Chabad. You can donate online at phillyshul.com. Help us keep our virtual doors open. And we'll see you next week.